So in addition to being very honored, I will say this has been a very nerve-wracking presentation to put together because it's hard to really honor someone who's done so much. So when you're nervous about a presentation, I figured the best way to start would be to start with a 1989 Nike commercial, which was the tagline, "Bo Knows." So for probably my non-American colleagues, I should describe this. This is Bo Jackson. Bo Jackson is a famous American. He played both in the major leagues in baseball as well as in the NFL for football. He's one of the few American sportsmen, I guess, who has been nominated to the All-Stars in 2 major league sports. And at least by American standards, he's considered to be one of the greatest athletes of all time. So I think with that description, you can see why I thought of him when I thought of David Back. So I had to at least try. So in this room, we know David very well for his work in the antivirals, both HIV as well as HCV now. But I think what maybe some of us don't know is his long contribution in history and contraception, which is really where he began his career. What David would never say out loud to anyone is that he's had over 120 publications in the field of contraception. So in and of itself, that's a career. And we all know he's gone on to do much more beyond that. So in preparing for the talk today, I went back and did my trusty PubMed search. And I found David's first publication in 1971. Simon and Garfunkel were at the top of the charts in the UK. And David's first publication was, as it's not unexpected, about the disposition of a drug via biliary secretion. Over the next 25 years, David published extensively on both female and male forms of hormonal contraception. And then, as we all know, sometime in the early 90s, his focus started to shift to HIV. And as far as I could find, his first publication in PubMed was regarding didanosine pharmacokinetics. His last specific contraception-only publication was sometime around 1998, and he went on to have an amazing career in antivirals after that. But then in 2016, we all know Adele swept both the UK and the US with her album, but David also went back to his roots a bit and had his first publication that I could find that married both his amazing career in HIV along with his contributions to contraception. So how do you quantify 45 years of publications? So David has much well and above this impounded car. And I found, thanks to Scopus, his work has been cited over 13,000 times. This is not specific to hormones, but I think it gives a context for his 45 years of contributions. So what's important to note is even though I'm talking about his somewhat historical influence on contraceptives, it's really important to note that that early work continues to be and remains very influential in the world of contraception today. And in fact, if you look at several or many review articles in the field of contraception, both within HIV and outside of HIV, you'll find David's work referenced quite heavily. As an example, probably the Contraceptive Authority, the medical eligibility criteria published by the WHO most recently in 2015, identified at least 10 publications from David that were cited as primary literature to support these guidelines. So with that information, I thought I should give this audience a little bit of a snapshot of contraceptive pharmacokinetics. So this is just a table that I put together recently for a review article where I was trying to compile what we knew about the pharmacokinetics of oral contraceptives. As many of you know, most oral contraceptives include both estrogen as well as a progestin component. Many of the estrogen especially, as well as progestins, have been used for decades. But surprisingly, we don't know as much about the pharmacology of hormones as we do about antiretrovirals. So if you search the literature pretty extensively, you can eventually find some influences of metabolic enzymes, both in the metabolism of the hormone and potentially some influence of the hormones on metabolism. But we don't really know anything about hormone transporters or pharmacogenetics or other things that we've become very comfortable having an understanding of in antiretrovirals. And I found when I was writing this review that a lot of the primary literature was really from David and David's group original work. So it's a huge influence. So I tried to think about how you would summarize 120 publications and 20 to 25 years of work in a field. And I realized that I would need another 2-hour symposium to do it justice. So very broadly, I just described David's very influential work on defining contraceptive hormone pharmacokinetics from everything from pharmacokinetics and drug distribution or disposition. He's done a lot of work on oral and other bioavailabilities of products across the spectrum. He's done a lot of protein binding work that really led the way in that field. And then, as I'm sure won't be a surprise to many of you, he's done a lot of work on the drug metabolizing enzymes and different mechanisms of potential drug interactions. So my approach to the rest of the talk is to just highlight a very few key things that jumped out to me that David's prior work in contraception contributed to the field, and then give a parallel to a lot of the work that many of you in this room are doing, with a few examples, perhaps picking a little on the conference organizers and future presenters. So this is a publication from 1975, and I think it was one of the first publications that I could find on hormones in general, and this is where David, you'll note as the sole author, described the metabolites of testosterone in the epididymis. And what struck me about this was in 1975, and really what he was characterizing here is the distribution of a hormone into what we would consider a sanctuary site. And to me, this translated very nicely to a lot of the presentations that we heard earlier today, and from Courtney Fletcher and his work, where he's looked at different antiretroviral drugs and how they penetrate differently into different tissue sites, and how this work is really foundational for some of the cure work that's going on. So I see a very clear parallel to some of that work with our current antiviral pharmacology areas. Next, I found a very interesting publication where David characterized the hormone concentrations of women receiving oral contraceptive pills in breast milk as well as infant and plasma blood samples. And this very clearly correlates to the Liverpool group's ongoing collaboration with a group in Nigeria that's looking at the pharmacokinetics of antiretroviral drugs in breast milk, and then also integrating some of the more novel things that we've learned about pharmacology from pharmacogenetics and other factors. And this type of work, and this translational work, will be highlighted in a few our later seminar speakers today from Andrew Owen and Sekou about both pharmacogenetics and drug compartments. Following that, I found just one example of many where David helped characterize the oral contraceptive hormone distribution or disposition after different routes of administration. So this was an evaluation of an IV, oral, and vaginal route of administration of 2 hormone drugs. And this, of course, made me think of Angela Kashuba and the nice work that we just heard from her before, where she has characterized the distribution of antiretrovirals into genital compartments, as well as looking at her most recent work from Caprisa. I found this recent publication looking at tenofovir administration via the vaginal route and correlating tenofovir plasma as well as vaginal concentrations. So again, a very nice parallel between this former hormone contraceptive work to our current innovative pharmacology today. And it wouldn't be a talk about David Back without some discussion of drug interactions. We know we'll hear a lot about drug interactions later from Katya, but I also wanted to highlight that David was really instrumental in characterizing the drug-drug interactions between hormonal contraceptives and all of the drugs on this particular slide. So just to give you a few examples of things that I think are probably relevant today, I'm pretty sure that David was the first person that characterized the effect of rifampicin on progestin when used concurrently. And what I found interesting as I looked back at all of David's drug-drug interaction work is it was all very intentional. And for this one in particular, not only did he describe the pharmacokinetic results and the plasma concentration changes of the progestin in combination with rifampin, he used 3 different measurements of enzyme induction to help also characterize how rifampicin may be influencing the co-administered drug. So he took a very deliberate approach to also characterize the mechanism of the drug interaction in addition to just the outcome of the drug interaction. He then, of course, went on to describe also the effect on the companion drug as part of the contraception with ethinyl estradiol. And as we know, rifampicin remains an incredibly important drug for our HIV/TB co-infected patients, and his group continues work with rifampicin today using some of the more interesting modeling and various approaches to supplement the mechanistic understanding that we've gained about the impact of rifampicin on antiretroviral drugs. One more example that I thought was interesting was David's early work characterizing the impact of both anticonvulsants and antimicrobial therapy on oral contraception and the potential risk for unintended pregnancies. So this is one of the studies that's cited relatively frequently. This was an evaluation of an adverse drug reporting system where he looked at all of the reported unintended pregnancies in women receiving contraceptives in addition to both anticonvulsants and antimicrobials. And he found overall about 100 reports of unintended pregnancies. And then notably, he didn't stop there and just report the kind of a case report of that, but he tried to quantify the denominator of this. Of course, it's very hard in a voluntary reporting system to truly do this, but he was able to look at the national health system and look at the number of prescriptions written for both of these products over that same period of time to help identify which of the 2 classes of medications may be a higher risk for clinically significant drug interactions. And then, of course, he followed that with what I believe is his most highly cited primary literature of a drug-drug interaction in contraception, and that was the characterization of phenytoin and carbamazepine on combined oral contraceptives. I could go on and on about drug-drug interactions, particularly with co-infections, in addition to his work with antimicrobials with oral contraceptives. He also did additional work in numerous other co-infection areas, notably in malaria and other important disease states, which we'll hear a nice summary about antiretroviral bacterial co-infections from Mohamed Lamorde later today. Okay, so with that context, I want to give you a little bit of his current involvement in hormone and antiretroviral work. So as I mentioned, his last publication that I could find purely in contraceptive steroids was in 1998. And then in 2016, we had a shared publication that characterized a significant antiretroviral and HIV therapy interaction and contraceptive interaction. So I figured if I was showing pictures of everyone else, I needed to show some old pictures of myself as well. This is a picture of myself and Seppi Mary with our colleagues in Uganda in 2005. This was my first trip to Uganda. I have to acknowledge Seppi here because she was one of the people that really inspired me to get involved in HIV pharmacology. And then relevant to this talk, she's the person that introduced me to David. And over the years, I was fortunate to be able to spend time with David at conferences. Particularly, my memories first of David are from this meeting in particular. I think as Giovanni mentioned yesterday, what's nice about this meeting is the ability to interact with a small group of really focused individuals. And then, as you know, David's always willing to take the time to talk with and really nurture and mentor junior investigators. And I can certainly say that I benefited from that relationship. So fast forward to, I think it was December of 2011, I had an idea for a study to evaluate the impact of the contraceptive implant levonorgestrel, or JADEL, in combination with antiretroviral therapy. Similar to David's prior work with anticonvulsants, there had been case reports of contraceptive failures, and we wanted to characterize this in collaboration with our collaborators at the Infectious Diseases Institute in Kampala. So this is data I've presented here before, so I won't go over it in a lot of detail, but this is sort of our primary results reported in CID this year. We followed women over 48 weeks, either with no ART, which is the blue line, nevirapine-based ART, which is the green line, or women with efavirenz, which is the red line. And in summary, we found about a 50% reduction in levonorgestrel exposure during that period of time. What was particularly notable about this study was we had sort of the ultimate pharmacodynamic indicator of the relevance of this pharmacokinetic reduction in exposure, and we identified, or we observed 3 pregnancies that occurred in our group of women on efavirenz. So 3 out of 20 became pregnant between weeks 36 and weeks 48. And importantly, we were able to we had examples of their levonorgestrel exposure immediately prior, or relatively prior to conception, which helps inform the potential threshold for efficacy for levonorgestrel. So to close, I'll echo some of the other comments that I don't think David is going to be done with this work just yet. He has some post-retirement work that we'll continue to work on with HIV antiretrovirals in combination with contraception. We were fortunate to receive a grant from NICHD to continue this work. And again, thanks to his connections, we're going to be working with Marco Siccardi on PBPK modeling, and he'll close out the session today discussing his innovative approaches with this. So with that, I again would like to thank everybody, especially all of my collaborators throughout the country. And again, thank you for giving me an opportunity to share with you David's prior life before HIV. Thanks very much.